Happy Independence Day. Let's talk about PAs and independence. Hi, I'm Derek. I'm a preventive cardiologist, and to set the stage for this conversation, as a physician, I will die a couple years early due to how rigorous my medical training was. I did 4 years of medical school, 3 years of residency, 3 years of fellowship, and then a year post fellowship. For those that want to practice medicine but don't think that sounds like a good time, there's the PA route. PAs recently changed assistant to associate, and I got in an argument with a bunch of physicians on Instagram because I support the associate name change. PAs collaborate with physicians, and who wants to finish a training program that, in my opinion, is harder than law school, only to be called an assistant? Or as another example, in football, a tight end isn't a quarterback assistant. They work with quarterbacks and have a different role on the team. So I'm a big fan of the PA MD model. But yes, the difference with physicians beyond not just medical school is our extensive residencies where we reside in the hospital. There's also a difficult to quantify element too about the vocation that many physicians have with the different lifestyle and training where life and work are enmeshed. So it's not just a job, but a vocation. With that grueling training and lifestyle, physicians get defensive about others having the privilege of practicing medicine that don't go through our extensive training periods. And I'm now seeing growing calls from within the PA profession for a pathway to full practice authority and clinical independence. I think that's an interesting discussion. One concern I have with independence, that term physician associate becomes problematic. Multiple professions try to lay claim to the term physician, but only medical school graduates are physicians. If PAs seek to function as autonomous clinicians, then the title should reflect that reality. Medical practitioner would be more apt and draw an interesting comparison to NPs. Either way, while I see a lot of fighting between physicians, PAs, and other professions, I think we should all agree that our system needs to be independent from predatory health insurance companies, unrestricted pharmaceutical companies, and corrupt politicians that prevent us from working collaboratively to best take care of our patients. I'd love your thoughts on this topic. Please comment below, share this with someone, especially a PA or doc, to continue the conversation.